Welcome back to Rossé TV. It's Breast Cancer Awareness Month this October, and we at Rossé are tying up with Mfine to do extensive breast screenings for our members. This screening drive is taking place at our center tomorrow, October 19th. And before we went into this screening, we invited over Dr. Rakshita from Mfine to talk to us about a few things related to breast cancer. Well, let's start with, the statistics.
Earlier, the breast cancer was known as a disease of the affluent society. But since last 2 decades, the trend is completely changed. As we can see, India along with US and China contribute to almost 1/3 of the global number of the incidents
Of breast cancer. That's insanely staggering.
Yes,
it's a very
yes,
large number.
Yes. Earlier, there was also a myth that it is a disease of whites, but now even that is proven wrong.
Okay.
In India, every day almost 2,000 cases get diagnosed.
Oh my. Okay.
And 1 in every 28 women, they have the lifetime risk of getting breast cancer.
That's absolutely true. I'm actually one of them. My mother was diagnosed with breast cancer almost 20 years ago. Probably one of the first cases that any of us had ever heard of at that time. So I have like a long history and a relationship with, this cancer.
Yeah, I can understand.
Yeah.
That's why this topic is very close to your
my heart, yeah.
Of course. So, and unfortunately, in those 2,000 cases, almost 60% of the cases, which amounts to 1,200 cases, they get diagnosed at an advanced stage. Out of those cases, almost 50 to 60% of the cases, they lose their lives in the first year.
That's horrible.
Yeah, so I think this is the time where we should have all the awareness about it. So that's why I'm glad that you called us for this.
I mean, we're really glad to have you here because I was very interested. A lot of our members and ladies were very interested in the technology that you all will be using for the screenings. It is 100% painless and radiation free.
Yeah.
And anyone who's ever gotten a mammogram can actually vouch for how invasive that test can feel.
Yes.
So tell us, how is this different from a regular mammogram?
Yeah, definitely it's very different from the regular mammogram. No, not exactly, it's like a mammography. As you know, as you yourself mentioned, mammography is a very painful procedure where the breast tissue is completely pressed in between the two plates and the extra of the tissue will be taken. So the accessibility, and definitely we don't have many centers who have this facility. We at Mfine, we are doing our Mfine screening procedure and it's called as the eye breast examination. It's an FDA approved device. It's completely radiation free, pain free, and it has almost a sensitivity of 84% and a specificity of 94%.
Okay.
So it's a handheld.
Sorry, what does that mean? Like sensitivity of 84 and...
No, it's like the detection and the accuracy of the detection
is 84%.
Yes.
Oh, that's pretty good, right?
Yeah, even it detects the lump as minimum as almost 0.5 centimeters. Which is not easily palpable by any hands. So that is one of its very important feature. So it's like a handheld instrument where our technicians go, they can come and cater our service at your doorstep, at your own privacy.
Because it's a very small, handy little thing.
Very handy machine.
Carry
Definitely it is a pain-free. And since it's the radiation-free, you need not worry about the risk associated with the radiations.
In fact, actually, Mfine does offer this in people's homes. So you can actually book this appointment and have someone come home and do this.
And following which on our platform, we have a gynaecologist. The patient who undergone this screening procedure, they will have a consultation with that. Definitely it's a screening. We cannot say whether it's a cancer or non-cancer, but definitely it diagnoses a lump at its earliest stage. So that makes a huge difference in a follow-up, what are the next steps of investigations and all. I'm not saying that it's a replacement for the mammography.
Of course not. I mean, maybe the mammography can be done when you're sure that there is something.
If we diagnose something with this machine, then we will be asking them to get mammography. So it's like that.
Yeah, that actually makes sense as like an early detection
Yes,
device.
yes,
This really
yes.
does.
Because like when you mentioned about early detection, as I mentioned, unfortunately 60% of the cases which
Are detected much
later
later.
stages, and almost 50% of those women will lose their life in the 1 year. And when you come to the economical burden, almost like the early detection versus late detection, almost it has a 1.5 to 2 times higher charges, like definitely,
Yeah.
because everything differs later.
And also it'll be frequent charges
Yes,
because there'll be chemo, surgery.
and even the survival rate decreases.
Yeah.
So the only key in all the cancers, especially the breast cancer, is the early detection, which changes the like survival rate later, and definitely the morbidity.
And also there's a 98% chance of survival if it's
Yes.
detected early.
Yes, yes.
So let's get to the symptoms of breast cancer. I think me and my colleagues almost every week we're like, I think I have breast cancer, something or the other. Like we're like getting paranoid about. But tell us in a very informed way what are the symptoms?
Okay. So to begin with symptom, the most common symptom is any palpable lump or a swelling, either in your breast or in your underarms.
Okay.
So that is one of the prominent symptom. Like next will be any change in your size, shape, or color of the breast, and then any change in the skin. Either it could be thickness, either it could be the color over the breast, or any pitching of the skin, or if you feel the skin is attached to the underlying structures. That could be a more important feature. Then coming to the nipple, any constant pain in the nipple, or any retraction of the nipple, or if you feel like any dimpling around it, or any nipple discharges, like it could be pus-like discharge or any blood stain discharge. And but like that is very vague symptom, but still a constant breast pain, where you have to exclude the cyclical mastalgia. When I mean cyclical mastalgia, like usually we women, like before periods or during the periods, we have some kind of discomfort. So even apart from this time, if you have any breast discomfort, then again that contributes to one of the symptoms. So if any woman has all these symptoms, I just request them not to ignore it. Please go and get evaluated with your gynecologist or surgeon.
The first point of contact usually is the gynecologist, isn't it?
Yeah, because definitely since most of the women they were following the gynecologist throughout the pregnancy or whatever, the gynecologist they will feel much more comfortable. But when it comes to treatment or management, surgeon or oncosurgeon are the point of contact where the disease will be managed or treated. But when it comes to diagnosis, definitely they can come and approach a gynecologist.
What are the risk factors?
Yeah, coming to the risk factors, the first risk factor is definitely a genetic. I think you have heard about BRCA gene 1 or 2. If
I haven't.
they're like genes, like if any changes in your DNA or a genetic composition. So if you have that BRCA 1 or 2 genes, then you getting cancer breast, the risk will be more.
The risk will be more. How do I find out if I have this?
So you can get gene detected. You have a test. So if you have a family history, then definitely you can go and get it detected. So for example, if you have BRCA1 gene, the risk of you getting CA test in your lifetime is almost 80%, 79 to 80%. When it is about BRCA2, it comes to 69%. So that is a very huge risk. So first thing is the hereditary or genetic, as I mentioned. And if you have any family history, like if your mother, sister, aunt, grandmother, if they have any positive history, definitely since you have the same genetic lane, so you are at a increased risk of getting the CA breast. And next is like obesity. Since in obese women, the estrogen hormones will be at a higher level, even that predisposes to your risk of getting the CA breast. And again, like one more important contributing factor in nowadays is like the alcohol intake. So when you compare
alcohol intake,
so when you compare a woman who takes almost like 2 drinks per day, so their risk is almost 50% increase to the other group who doesn't drink at all.
Okay, absolutely.
So again, because like alcohol intake, it increases the estrogen levels in your, and when it is like a chronically used, so on over a period of time your risk will increase.
Okay.
And again the obesity. which the trend is increasing nowadays. So again, it's like a hormonal. Like when you're obese, your hormonal will be the imbalance will be there. Estrogen exposure will be loud. So again, your risk will increase. So these are few of the risk factors of getting CA breast.
Okay, all right. So, there are a lot of myths also surrounding breast cancer. Like, there's always younger women who are like, I'm not at risk. There's other women who are like, I don't have a history, so I'm not at risk.
Yeah.
Can you bust a few of these myths for us and, present some of, that probably we also don't know of?
Yeah. So as you mentioned, the age, definitely. So always it was thought as a cancer of the later age. But when I talk about the statistics, almost 7% of the CA breast is diagnosed in less than 40 years of age.
Okay.
So, like when you compare the cancers around 40 years, it amounts to 40% in that population. So, as I mentioned, so now it is no more a risk of an elder population, but definitely the age is directly proportional to the incidence. So, when you're 60 years, so you getting breast cancer is like 1 in 28, but at the age of 50, it is like 1 in 43. But no age is safe or from this, like getting the CA breast.
Honestly, it's like one of those things that's so rampant now. You're saying it's just better to be safe than sorry.
Yes.
Okay, that's
one more thing. And one more thing, like we always think that since it's a CA breast, it is always common in women. It's not like that. Almost 1 to 2% of the total cases, they are diagnosed in male also.
Okay.
And unfortunately, they are like diagnosed in very later stage.
Because nobody ever thinks of looking,
yes.
right?
And it's like they'll get diagnosed in very invasive stage.
Okay.
So definitely the cancer-related deaths is also more. So if you have a positive family history, for example, your mother, your sister have already diagnosed, so I request all the men to get their genes checked for BRCA 1 or 2. So that is one more thing.
And what about like you said, family history? Like, a lot of women feel only if you've had someone in your family suffer from this.
No, I mentioned like when you have family history, your risk of getting CA breast increases.
Higher, yeah.
But definitely, the gene mutation can happen at any level. So, like for example, I don't have any family history. It doesn't mean that I am safe from getting CA breast. So the general incidence remains the same.
I think the 3 people whom I've heard of who had breast cancer had no family history.
Yeah, that's what I'm trying to tell.
Yeah.
But if I have any family history, definitely my risk will increase.
Is high.
But it doesn't mean that since I don't have, my risk is 0. So please always be aware of it. So for example, as we discussed earlier, it's like an early diagnosis.
Yeah.
So nowadays there are lots of diagnosing modalities. To begin with, like self-breast examination. So always because most of our population are getting aware, they're educated, can train them how to get self-examined. If you have any doubt or any suspicion, don't ignore. Go and directly meet your gynecologist. And if any doubt, even after that, you can go and get the sonography done, which is a painless. Or you can directly go for a mammography if you have any positive or strong suspicious. You can get an MRI done. Or before that, as a preventive or screening, as we discussed about our product, we can always get it done.
You can always bring them home.
Yes,
and then come home and do
course.
it for you over there.
Yes.
And finally, before we were wrapping up, I also wanted to maybe ask you, how often should we be getting a breast examination? Because it's Breast Cancer Awareness Month, so we're talking about this, but
Yes.
it's important that we talk about this outside of October as well. So how often should we be scheduling an appointment to get this done?
So, okay, it's a very important question. So as you mentioned, the awareness should start around 30. As I mentioned, even 7% of the cases are diagnosed less than 40 years. So the thought process of getting screened should start around 35 years of age.
Okay.
At that time, if everything is normal, you can get it done once in 3 years. After 40 years, you can get it every second yearly. But if you have any positive history or if you have any symptoms, so then all these the radiation-free procedures you can get once in a year also.
Once a year also, yeah. All right.
But it's not always mandatorily advised to get it once in a year, but definitely once in 2 years that's what I recommend to my patients.
Definitely. So the Mfine eye breast examination will be administered here tomorrow, October 19th. And following which
they will be consulting
with Dr. Rakshita, which is going to be amazing. And we hope to see you all over here. If by the time you're watching this you've missed it, you don't have to worry. Just download the Mfine app on your phone or log on to Mfine online, and you can book yourself an n number of tests, including the breast cancer screening test. Thank you so much for coming and
thank you for the
talking to us
opportunity,
today.
and definitely it's a good initiative, and I congratulate for this beautiful
space.
Of yours.
Yes, thank you.
Yeah.
This is our first interview within this space.
Yeah.
It's sort of like a momentous occasion.
Yeah, thank you.
Thank you so much.